Hi everyone, I'm Jessie Barr. I'm the performance psychologist within the Aspire Orthopaedics team at the UPMC Sports Surgery Clinic. This evening, I'm going to talk to you about give you a little insight into the work that I'm doing within the Aspire team around using performance psychology strategies to enhance recovery from ACL reconstruction. So, what is the state of play in ACL recovery according to the research at the moment? According to the results of two systematic reviews and meta-analyses conducted on nearly 8,000, 7,500 patients, it was found that 85 to 90% of ACL reconstruction patients returned to fully normal or almost fully normal knee function after their operation. However, these studies also found that the rates of return to performance among these patients was not reaching those same high levels as 85 to 90%. What they were finding was 81% were returning to general physical activity or general low levels of sport participation. 63 to 65 were returning to their pre-injury levels of sport. So only 3/4 of those who had an ACL reconstruction were actually returning to their pre-injury levels, pre-surgery levels, and up to half were returning to competitive levels of sport. So what the surgeons were finding in Aspire is actually reflective of the current state of play within the research, that while many will return successfully to normal knee functioning, not many were actually making a full return to competitive sport. And that's where I've come in to give some support from that psychological point of view. And how I'm going to illustrate that is through a case study of one of the athletes that I came across quite early on when I started within the team. So with this case study, we're going to look at a female GA player, Gaelic footballer, who was in her early 30s. She was presenting with her second ACL reconstruction in 3 years, and it was on the same knee. So she was back into Santry to get her knee redone again. She was referred to me by her physio at about 7 months, which would be considered that kind of return to play phase. This stage, she should have been running, turning, jumping, and involved with general football related activity. She was hitting at this stage all of her physical targets and key performance indicators in her rehabilitation program. So physically, she was ticking all the boxes that were indicating she was on track to make a full successful recovery. But her progress had stalled. She was stuck at the straight line running phase, which would you typically be much earlier in a rehab program, probably at the 4 to 5 month mark. This athlete was 7 months in and still hadn't got past straight line running. Why was this? What was some of the issues that she was presenting with? And one of the main issues that I could see from my early work, my initial consultation with this athlete, was that she was experiencing significant re-injury anxiety or fear of re-injury. Re-injury anxiety and fear of re-injury are consistently cited as the most significant reasons for an unsuccessful return to performance or a lack of return to performance. So maybe a longer return, a more stunted return, or somebody who doesn't return at all to their pre-injury levels of competition. So these are really important factors that I will see a lot, and a lot of ACL patients will experience. So what is re-injury anxiety? Re-injury anxiety is cognitive and emotional reactions, so thoughts and emotions in response to the anticipation of negative consequences of re-injury. So it's quite future focused. It's focused on what may happen if I have an injury again. So this could be thoughts around having to do a surgery again, having to go back to the start with rehab, and what that might mean in terms of their season, in terms of their progress so far, and what it might mean, for example, their place on the team. It can manifest in lots of different ways with negative emotions like frustration, hopelessness, anger even, and it can just be persistent worry and just general uncertainty that the athlete's presenting with. And as a result, the athlete may want to avoid certain movements or activities. What I was seeing with this athlete in this initial consultation was significant re-injury anxiety. She was terrified, essentially, of injuring the knee a third time, or even injuring her other knee and requiring surgery on the other knee that hadn't yet had a surgery. Fear of re-injury, on the other hand, is more of a response to a perceived threat of a re-injury in the moment. And the challenge of this is it doesn't always present when an athlete presents to the physio or the surgeon or their clinical specialists on checkup. It usually only manifests when they're actually in their place where they do sport. So on the pitch, on the track, wherever they are. So it's that immediate emotional response, so that immediate fear and stress response, and fit behavioral responses, which could lead to avoidance behaviors as well. So the fear of re-injury presents in the moment when a person is presented with the opportunity to do something that they fear could cause a re-injury. Where this athlete was experiencing this was on change of direction. So as I mentioned, she was stuck in straight line running. Change of direction, turning on the pitch was causing a huge fear of re-injury, having a strong emotional reaction at the pitch. She had a strong fear of movement and the fear of the pain caused by the movement. And it was leading to these fear avoidance beliefs, which are the thoughts and emotions that were driving the fear that she was experiencing about these change of direction, these turns causing further injury. So just to understand re-injury fear and anxiety, it's a really important factor for me to understand and to understand the sources of it, because these fears and anxieties can create some quite strong, long-lasting beliefs. So I needed to understand the patient's story. What was going on up until now, where I'm meeting her at 7 months, what has created this fear and anxiety, and why is it presenting so strong, and why is it presenting now? So again, back to the case study of my female GAA player. Her first ACL that she did in her 3 years prior was very successful. There was a smooth rehabilitation and recovery, and she had a full return to performance within 10 months. Her second ACL, she was already significantly behind on her timelines by the time I met her, and according to her physio, had been quite behind on her timelines all the way along, had experienced more setbacks. She had family members who had had ACL reconstructions as well, to various levels of success. So brother and 2 cousins, all male. And some had made full successful returns, one had not returned to sport at all. So her experience of those around her had been quite mixed, so it wasn't instilling her with confidence either. She was working full time as a teacher, so she was quite conscious of spending a lot of time on her feet. She wasn't getting to recover and rest the injured knee as much as she wanted, and didn't have as much time as others to maybe dedicate to her rehab and her recovery. She was one of the most senior members of her club and her county team, which was really important to know, because there was maybe an element of pressure, there was an element of expectation, and whether that was an external or that was self-imposed, she was quite a senior member and had, aspirations of returning. And finally, what was another really interesting factor to understand in her story is she was nearing the end of her playing career. And why is this important? Well, when we talk about re-injury anxiety and the anxiety related to the future outcomes of an injury, she thought she was too old to have to go through the whole process again. So if she was to get to re-injure the knee or injure the other one, she thought that was probably going to be the end of her career. She didn't have that much time left in her and in her playing career. So that was something that was really important, probably driving a lot of that anxiety, was that she really just felt that her clock was against her. So just to take a step back and understand what some of the potential psychological responses to sports injury can be, and what maybe creates those responses, I'm going to introduce the integrated model of response to sports injury. So this model indicates what could create the psychological and emotional responses to a sport injury, and also to the rehabilitation process. And that response is actually created before the injury even happens. So that can be linked to personality factors, history of stressors, coping resources, intervention. So what does that person already have access to? What type of person are they? Are they someone who's tendency to be quite anxious? So even before the injury happens, there are some factors that can create the response. Then once the injury happens, once the ACL has been torn, there is a number of factors that will impact and contribute to the emotional and psychological responses that the athlete will present with, both at the time of injury, both and throughout the rehabilitation process. So the athlete will take into account for their personal factors, things like their injury history, have they experienced of injury previously, for example, their individual differences, so their motivation, their athletic identity, which I will speak about in a little bit more detail in a while, that idea of how much they identify with being an athlete, what age and gender they are, all of those personal factors can contribute. Those are then combined with things like the situational factors, so the sport, when in the season, is it right coming into the start of the season versus the end could change the psychological response. Who are the people around them, those social support networks? Is there a lack of social support, or is there good availability of support to the athlete? Those are some situational factors that can create positive or negative responses. So as you can see, quite complex, no way to really predict how any athlete is going to react. So getting that understanding of the person, understanding their story, understanding the beliefs they're taking with them as well, can give an indication of where I can offer my help and support. So what does her player tell me about that? Why was she experiencing it? So thinking back over the story that I shared, she had a very strong belief that if she was having slower progress, which she was in comparison to her first knee, that it meant there was going to be poorer outcomes. So she had this belief that she had created that because she was not hitting timelines, she was not going to make a successful return, and had nearly made that decision just by maybe speaking to other people and just coming to her own conclusions. She had less opportunities to build trust and confidence in the knee because she was avoiding a lot of opportunities to build that trust. So she was avoiding drills, she was avoiding some activities at training, which would be opportunities to build confidence and trust in the knee at that later stage of her rehab. She had what we call perceived susceptibility and a lack of control. So this athlete was presenting with the belief that, my brother has had an ACL reconstruction, two of my cousins, I'm on my second. Maybe we just have bad knees or bad ACLs in the family. So suddenly she was kind of accepting that she didn't have as much control over this injury as she maybe had once thought. And there was a perceived susceptibility. She's just someone who's going to get ACL injuries. And there's nothing I can do about that. So this almost learned helplessness was starting to kick in, that no matter what I do, I'm probably going to get injured again because look, I'm here again and my family has been there too. Because of her full-time job, as I mentioned, she did have less time to dedicate to her rehab and recovery. As I mentioned earlier, the idea of athletic identity is one of those personal factors. So she was a club and county player, one of the most senior members and a really valued member of both teams. And she was someone who herself identified very strongly with being a footballer. She'd identified first and foremost as footballer before she identified as teacher or as anything else. So it was a big part of her self-concept, who she was. And so and in research will say that someone with a very strong athletic identity may struggle with being away from their sport and not being able to, I suppose, fulfill that identity. So there didn't appear to be as much external pressure from teammates or managers on either team, but she was definitely self-imposing pressure on her return to play and returning to the pitch due to her age. So she really felt the time was running out and the clock was against her. So understanding those beliefs, so understanding those contributing factors was starting to paint a picture of where these re-injury fears and anxieties were coming from and what I could do next. Where could we go with this? So my plan and interventions started with confidence building, as I just gave a little indication of. I recognized that the athlete was presenting with a high level of anxiety, but very little confidence. And one way to counteract the anxiety she was feeling was to build that confidence in her knee and in her body. And at that time, it was very, very low. So we needed to go back and reflect on the work she had done up until this point, on the rehabilitation process that she had done until 7 months. Reflect on that, think back through it, reflect on training logs, go back to her first her training logs from her first ACL and make some comparisons as well. We needed to do some cognitive restructuring through self-talk, which is that internal dialogue, because when we spoke about what it was she was telling herself, where was her head when she was at training? What was she telling herself throughout the day? Where was her attention when throughout the day? Every little niggle or every little, awareness in her knee was creating or confirming the belief that her knee was weak. It wasn't going to be able to take the demands of change of direction and further match play scenarios. So we needed to challenge those beliefs through self-talk interventions, identify those negative, unhelpful self-talk that she was engaging in at training and throughout the day, make note of it, and then create a more helpful script to counteract it so that she had something to respond and challenge and stop those unhelpful thoughts from spiraling and going unchecked. So that was something that was a constant theme throughout. One big part of the work we did was actually just going back and doing some goal setting. Seems really, really simple, but there was some real glaring gaps in the goal setting that she had been doing up until that point. So we looked back at doing some smaller goal setting, and I'm going into a little bit more detail on that in a second. Then we did an imagery intervention, which is also known as visualization, to try and build confidence in the activity she was going to be putting herself forward for that she had been up until now avoiding. So that was change of direction and some match play scenarios that were causing a huge amount of stress. And that stress was leading to her avoiding those movements and avoiding those activities altogether. So imagery was a way of practicing, doing some mental rehearsal of being in those scenarios, of feeling confident in those scenarios, or feeling nervous and still doing it without having to put herself in those physical scenarios. So it was a way of training her brain to feel comfortable and confident with those activities before she actually put her body in the situation to do them. And finally, I just taught her some relaxation exercises, because what was quite clear was when she was at training and when she'd moved past the easy drills that she was confident with, straight line running, and they were moving into more complex drills, change of direction and more match play scenarios, her stress was shooting up. And as a result, she was creating a lot of tension physically and tension mentally as well. So that tension physically was linked then with some unhelpful self-talk. So we had some self-talk interventions, but we needed to make sure her body wasn't tensing up and creating unnecessary barriers through that physical tension. So just some simple breathing activities when she noticed those little triggers of those unhelpful thoughts or that tension that was maybe in her jaw or in her shoulders. We just did some breathing activities to just relax, center herself, ground herself, and then be able to maybe attempt the start of what she was hoping to put herself forward for. So they're just some examples of the plans and interventions. So in terms of the outcome, and I said I will talk about the goal setting in a second, but in terms of what the outcome looked like, now this athlete, I must preface, was very engaged from the start, really bought in. After about 20 minutes of our discussion, I could see that she really wanted the help. She really wanted to be involved in this process, and it made the work I did much easier. So the athlete did present with this re-injury anxiety and fear of re-injury. We had 3 consultations, which looked at those 4 or 5 interventions. After those 3 consultations, she felt confident enough to return to performance and played just 10 minutes. She was delighted with that, just 10 minutes. Following that, we had 1 or 2 more consultations throughout the season. And after those, she felt confident and ready to return to full match participation. So for the first time in her rehab for that second ACL, she felt psychologically ready to return to match participation, to match play, and was able to overcome those barriers. Again, everything was to do with the athlete, how engaged she was and how willing she was to give everything a go. So I mentioned goal setting, and this was a big part of our intervention and probably bigger than I anticipated it being, because it always seems like one of the most simple interventions, but it can be so, so effective if done right. So what I recognize in my early discussions with athletes, I always want to identify what their goals are for their rehabilitation, their recovery, and what they're hoping to return to. And where she was at 7 months, this was an athlete who could only run in a straight line. Her overall goal was the top of that set of stairs was to play a match. And I said, okay, well, we need to bring it back a bit. We're a really long way away from playing a match if you can't do anything bar running in a straight line. So we discussed what would be the next steps from where she is. And she said, okay, well, the big goal then, taking it back a number of steps, was change of direction at speed with the ball. So that became our main focus. We parked the match. We said, we'll come back to that, but let's just make a smaller, more achievable target that is not, doesn't seem so daunting. And what I realized with talking to her, and something I've recognized with a lot of the athletes that I've been working with after an ACL reconstruction, is there aren't enough of those kind of smaller incremental goals between those large milestones. And this is probably most evident in the latter part of the rehab. Because obviously early on in the rehab, it's very controlled, it's gym based, and there's a lot of small goals to hit. Once the athlete moves out onto the pitch or out into the field of play and they're back in training, suddenly the jump becomes much bigger with less kind of smaller goals to kind of build that confidence up slowly in the way that we're being done in the gym. So really that was where that lack of opportunity to build the confidence and the trust in the knee was presenting, because she hadn't had the opportunities to actually do that. She was just trying to jump too far forward. So what we did is we revised her goal setting. So instead of it being match play, we parked that completely and we said, okay, your performance goal 1 is that change of direction at speed with the ball. We set that at the top of that set of stairs for where she was at now. And again, we brought it back. So that's the performance goal. That's a performance indicator that she can move on to the next. Once she was able to change direction at speed with the ball, she knew she was ready to move on to the next step, which was 1 step closer to match play. But she wasn't there yet. She was still at straight line running. So I brought her back again and said, okay, we're at straight line running. What do we need to add next? What's the next process? What's the next step? The next process was just change of direction, being able to participate in change of direction drills at a steady pace. Then she was ready to progress to the next step, that next process goal, which was a change of direction drills at a steady pace, adding in a ball. So adding in another small demand. Once she was ready to do that, move on to change of direction at speed. And finally, then she could move on to that performance goal. So we broke it right back down. It seemed like it was baby steps, but that's what it was in the gym. So we needed to apply that thinking to the pitch work as well. So that's what we wanted to do, is add in those extra steps to build trust and confidence in the knee. So rather than going from running in a straight line to fast change of direction with the ball, we needed to add in some steps to build that confidence and make her feel that she was able to do it. And we didn't move on until she was ready. So we've come together and recognized that the best approach is getting in as soon as possible and offering that support as soon as possible. So my approach now looks like, again, still understanding the backstory. I offer athletes a discovery call, so a free 30-minute call to just give me a background to who they are before they ever commit to initial consultation, because I know it can be quite daunting. And even in that initial consultation, it will be a lot of opportunity to understand their story and their background, understanding the injury, what happened, what was their experience, what are the potential repercussions of this injury on their season, their timeline, just to kind of get a sense of what their emotional response looks like and how they're feeling in that immediate, in that initial time period, in that early stage of rehab. I want to understand their previous experience of injury, because that can really shape how they can apply their skills and apply their knowledge to this new injury. If it's their first, it can be very different to someone who's had an injury before. Someone who's had an injury before may feel competent and know what's to come, or maybe having had a previous injury, feel dread because they are aware of how taxing rehab can be. So that knowing if there's a previous experience of injury can be really, really valuable. Understanding the level of athletic identity. So how much does that athlete identify with their athlete role, with them, Is their identity shaped by being an athlete? Are all their friends athletes? Is their social life centered around their sport? Are all of their friendships centered around their sport? And is all their spare time centered around their sport? That's important to know to kind of direct towards different strategies. So identifying how an athlete can manage their time depending on their level of athletic identity. They identify quite strongly. We want to find ways to maintain that identity in a different way while they're injured. And just understanding what other interests, pursuits, and what else is going on in their life. Are they working? Are they in school? Are they in college? Or are they full-time athletes? So just understanding what else are going to be there to distract them during this rehabilitation process. Understanding their current knowledge. So what do they know about ACL reconstructions? What do they know about the rehabilitation and the recovery? Do they have any experience with other people? Does any of their teammates, family members, friends, and what was their experience? And are there any beliefs or fears they hold about the rehab process or that return to play? Are they someone coming in saying, understanding that only half of people return to full sport and full competitive levels? Or are they someone coming in believing that the harder I work in my rehab, the more likely I am to return? So understanding where they are at the moment and what their beliefs and knowledge is. Identifying those goals that they have of the rehab and recovery and of the psychological support I can offer. Or is there a certain timeline they want to get back for, or are they willing to just see it out and return when their knee is ready? So just identifying what those goals are is really important early on to help manage expectations. As I said, expectation management is a really important one. So if we understand their goals, we can then start to put in those strategies to manage expectation, helping them understand that setbacks will happen, when they may happen, how they may react if they do, kind of nearly preempting it. I use the self-determination theory as a framework for initial interventions. And I'm going to talk about that. What is a self-determination theory and how am I using that to shape those early stages of interventions with new patients? What is the self-determination theory? The self-determination theory encompasses three concepts. The concept of competence, which is where a person is motivated to gain mastery, to feel capable and effective in their own actions. So an athlete wants to feel competent even when they're injured, even when they're rehabbing. We want to encourage autonomy with the athlete. So we want them to feel in control of their choices and in their day-to-day life. One thing a lot of athletes will say is they don't feel that they're in control of their decision making, of their life, of their day-to-day when they are rehabbing, because someone else tells them what they should do, when they should do it, when they can do more, if they have to pull back and do less. So there can be a feeling of a lack of autonomy during the rehab process. So what we want to do is create opportunities for autonomy. And finally, the self-determination theory of motivation. And the last factor is relatedness. So it's that idea of feeling connected and belonging to others. It's a way of recognizing that they feel cared for and supported. So this self-determination theory, the theory of motivation, and it's all three of these factors can combine to create a motivated athlete who will see out their rehab, who will stay engaged in the process, and hopefully feel more in control of that throughout. So what can that look like? What are some of the strategies that I do to try and create a self-determined athlete? So if I want to encourage an athlete to be more competent, something very simple at that early stages, I suggest athletes keep a recovery journal to record their progress, record any signs of improvement or any upskilling that might happen. So with an athlete, we want them to take back that bit of control, to have a bit of more autonomy, but also see that competence grow, because that competence is what creates that confidence that we see later on and that trust in the knee. So if they're witnessing their recovery, they're recording their progress, and they're not waiting for the physio or the surgeon to give them the green light, they're also seeing it in their own eye, with their own eyes, and they're recording it. They're creating that confidence throughout the rehab process and feeling more competent in the rehab and in their knee. We want an athlete to be more autonomous. So while they feel a lot of control has been taken away, they can't engage in their sport, we want them to identify opportunities to develop other skills during the rehab period. So while the injury initially could have brought on all of these really negative and unhelpful responses, we want them to see that an injury can be a time of opportunity. It can be time to develop a more rounded athlete that you may not have time to do when you're training full time. So encouraging the athlete to seek out those opportunities. Maybe it's developing other physical skills like fitness on the bike or upper body, for example, or maybe getting involved in the sport in other ways. So still staying involved in the sport and taking back the control of maybe their tactical awareness by doing some video analysis, or the strategic awareness by doing some stats work for the team, or just even offering a little bit of coaching and just feeling they have something to give back and they have control over their choices. And finally, a self-determined athlete is someone who has that relatedness. They feel related to others. So helping that athlete at that early stage, identifying who the sources of social support are going to be and what the types are at different times. So how can they use them? Who are the people who have been through it before, and can they seek guidance from them about their experience of surgery and injury and learn from them? And who are the people that they want to be around when they need a break from all things sport and injury? So we're at that early stage. Now that I'm getting athletes much earlier in through the referral processes, this is the type of work I'm doing with them. And then as we move through the rehab process, we go back to things like goal setting, cognitive restructuring, expectation management, those kind of strategies. But at the moment, that's where I keep my focus. Create those self-determined athletes. That's bringing us up to the end of my talk. Thank you all so much for listening, and I really look forward to answering everybody's questions.